Who is ready to see if it worked? This is her before picture one last time. And this is what she looks like today after the procedure. And you can even see her in person because Lynette joins us along with board-certified facial plastic surgeon, Dr. Nima. Most importantly, Lynette, how do you feel about it?
I feel amazing. I mean, it's improved so much. My face looks a lot thinner. My teeth grinding has improved extremely, and it was a fast procedure.
Have you noticed any changes just in terms of, obviously there's a physical change, but in terms of maybe grinding and things like that?
Yes, even the way I talk, the way I pronounce my words. I don't know. I feel so much better. I sleep better. I wake up in the morning and I feel more rested.
And there's a reason for all that, and I don't want to take any of the wind out of your sail, Dr. Nima, there, but what you're doing is injecting one of those muscles, the biggest muscle involved with chewing, the masseter muscle, correct?
Definitely.
And that's why it makes sense that you're a tooth grinder, and that it's like working out a muscle. That continual grinding makes that muscle enlarge. And explain to us how you reduce that, and in turn, her TMJ, her jaw joint is working better.
Yeah, that's exactly right, Dr. Orton. The jaw muscle that wraps around your outer jaw just gets buff over time from chronic teeth grinding, and we inject a little bit of Botox to relax that muscle and slim it down so it's not as strong. So at nighttime, you don't grind as much, and relieves headaches and ear pain and even some TMJ joint pain as well.
For Lynette, she had such a beautiful jawline, but I know what you're saying, that fullness there, that a little bit of that Rob Lowe, Brad Pitt, Travis Stork, squareness there, that for a guy, it works.
It's more of a masculine look.
It
That's
is,
why it's more feminizing.
But just by bringing you in a little bit here, but you still have that great jawline, I think.
Thank you.
Yeah, I was just joking with my patients, though. It's only the circus performers that have to hang from biting, their teeth. Those are the people who can't do it because you need that strong bite muscle. That's all that it really, the main side effect. That
So then do you, with this procedure, Dr. Nima, you recommend Lynette have this done periodically since, or is this, once you relax that muscle, it'll hopefully not come back quite as strong?
Typically these results can last up to about 6 months, but what we also find is that people kind of break up that vicious cycle of that chronic teeth grinding. So they may not need it every 6 months, and basically they just come back in whenever they need it.
When we started hosting this show, pretty much Botox was for wrinkles. Now it is for so many other treatments, and clearly in your case, Lynette, it did a great job. We're happy you're feeling better. Dr. Nima, excellent work. Let's see what's coming up next.